Hi, I'm Liam Dann. Welcome to Money Talks. This is a podcast about our relationship with money. We're not going to tell you how to get rich, and we're not going to try and pick the next interest rate move. In this series, I'll be talking to some interesting New Zealanders about how money has shaped their lives and what they've learned about it through the years. My guest today is Ranjna Patel, founder and director of Tamaki Health, New Zealand's largest independent primary healthcare provider with nearly 50 clinics, and the woman behind Serenity Foundation and the successful Gandhi Nivas anti-violence charity for men. Kia ora, Ranjna. Thank you for being here on Money Talks today.
It's my pleasure. Thank you for having me.
Now, can I ask, I guess the first question is always going right back to childhood. Do you have first memories of money in your hand growing up or being around money when you were a child?
I thought about this, and money was never uppermost in our minds at the time. I was born in a fruit shop in Herne Bay in a joint family. I was the third sibling. There were 7 of us with my uncle, aunt and mum and dad. I learnt my business skills in the fruit shop because after school, automatically, 2 of us had to go help cook because we were the pit stop for most of the people that came from India, young men venturing out, and so they sort of stopped in the shop, slept on the floor there until they found their feet. And so 2 people would be cooking and one of them had to help in the shop. Those were the days of pounds, shillings and pence and pounds and ounces. No calculators.
I bet.
So you worked out your money very quickly. And those were the days, the fruit shops, no one touched any produce. You put the produce in the bag for the customer. They would say, a pound of this, you would give that. And so giving customer good service, because if you put a bad peach in and they've paid good money for it, they're going to come back very quickly. So, respecting the customer was the first business lesson. Dealt with money, but never thought about money at that stage. The only thing I felt probably a bit deprived, we couldn't have frozen vegetables or tinned fruit. We always used to have fresh everything.
Well, I guess that kind of answers some of the other questions I have around, first part-time job or pocket money. You were just in the family business from a young age?
From a young age, and then we were legally allowed to work. I had my first job in, I think, 5th form. At George Court's on Thursday evenings when that was their late nights in K Road. And even that was to me the first time you actually earned money, which was very different from working in the shop because you didn't get paid when you worked in the shop.
That was just part of the family expectation.
And we still have to do that in the weekend, even we did the George because it was only Saturday, half day then that the shops were open.
Sure, but you must have got fairly good at, as you say, with doing the maths and arithmetic around handling money, and do you think that rubs off in terms of being quite sensible with money?
I think very sensible and probably very, very careful with money. I say to my husband, he's very lucky. I'm not into jewellery, I'm not into shoes, and I'm not into handbags. And so very simplistic in how we were brought up, I think, is sort of the core way that I've lived through all my life.
Yeah, and I mean, for people who don't know Auckland history, I mean, Herne Bay was probably a very different place then. It's a super rich suburb now, but it wasn't back then. How do you recall the suburb?
Well, in my class at Bayfield Primary School, I think there was about 6 Europeans. The rest were Pacific, Māori and Indians.
So really it's at the end of Ponsonby, and these were the days when Ponsonby had all that sort of bohemian chic and rock and roll.
It was the first stop for majority of the Pacifics in the 50s and 60s. So, very heavily Pacific population in Ponsonby.
So did that give it quite a community sort of feel around the shop?
Very much so. It was the same customers that came because there was no supermarkets. Everybody shopped at fruit shops. And so it was a community. You knew everybody by name, and yet it's quite a big suburb. And there was 3 fruit shops on our street. But, people that came, you knew. We did home deliveries. We went to the St. Mary's School. And so we were exposed to a lot of things there.
Yeah. And was there a sense, I mean, in those days, New Zealand was generally a bit more egalitarian anyway, but was there a sense of money being an issue in the house with just getting by, paying mortgage and things like that? Or did you feel like you were reasonably comfortably off as a family?
I think we worked hard and money was never discussed, or if we wanted anything. When you're living in a family of 11 people, you don't have many wants.
Right, yeah.
Because I can't remember a birthday being celebrated or Christmas being celebrated or Diwali being celebrated. It was just business as normal. On, Christmas we'd go out to the beach.
Yeah.
And Saturday my uncle or my dad would take all the kids out to Mission Bay or Savage Memorial. And to that was our treat.
Yeah.
And we didn't, none of us ever had to think about money.
Yeah.
We needed clothes, you sewed them.
Yep.
You needed jumpers, you knitted them. And that was a trait all girls learnt.
Yeah.
That you learn to survive.
Yeah, absolutely. And when you finally, as you say, you got your own part-time job in your teens, was there having a bit of money in your pocket? Did that enable you to spend on things? Were the things that you liked to enjoy or you saved up for?
No, I think that was more just my freedom.
Yeah.
Because you're in your family environment, strict Indian upbringing, and I had it out.
Yep.
To go out and work. I don't think I did it for the money.
Yeah.
I did it more for the fact that I could go out and meet other people.
So you're probably, saving that money anyway.
Yes, I was saving it anyway.
And how about school? Did did money and career sort of influence your choices in what you were doing at school?
I think more so money didn't influence what we were doing, more so the fact that we were girls. I wanted to do medicine, and I didn't get into Auckland, so Otago was the choice, and my parents said, no, you're not going down there.
Just the cost was prohibitive?
Not the cost, I think, just the social environment.
Oh, yeah. Reputation.
Reputation more than anything. And so I went to Tech.
Yep.
It was called ATI then.
Yep.
And so went there. Fees were never discussed. It wasn't a problem. I got a bursary, so, that was fine. But parents never sort of disabled anything.
Sure.
You could do what you wanted to. Yep. But going to Dunedin wasn't an option.
It's too far. So at ATI, did you do nursing or specific medical thing?
I did industrial chemist.
Right.
And in my third year, I was sent off to India.
Yeah.
I was just reflecting. I went to Australia on the 27th of November,
yep.
and I actually went to India on the 27th of November, met my husband on the 30th of November, married him on the 8th of December.
Wow.
And it'll be 50 years this week.
Yeah. So did you meet him in India?
Arranged marriage, yes.
Yeah, I see. Yeah. And so it's obviously worked out.
I think so. We tolerated each other for 50 years.
Yeah, that's great. And so he was a GP, or he was training to be a doctor, was he? Or?
No, he just qualified. And most of his class, 70% of his class went to America. Yep. But because he married me, he came out here.
Yep.
And in the first few years, 18 months, his degree wasn't recognised.
Yeah.
And so the council would say, get a job at the hospital and we'll give you your registration. And the hospital say, get your registration and we'll give you a job.
Yeah.
No one would say how to get it. And then finally someone said, sit this American exam and if you pass it, we'll give you registration.
Wow. Yeah.
So, in India, to get into medicine with just so many million people is so hard. And then to come to New Zealand and struggle to get your degree recognised was very frustrating.
Yeah, you still hear stories like that sometimes of people who have really great qualifications, but the system just isn't set up to accommodate them. Or,
And very much so now, we're big doctors shortage.
Yeah.
But there's so many doctors qualified overseas that are sitting doing nothing.
Yeah, it's a shame. And so once he was qualified, I guess he set up. Did you sort of work with him in the practice?
Well, he wanted to be a specialist because he was very bright, and a very a doctor that took him under his wing says, "Look, New Zealand's not ready for a specialist with an accent, coloured." You've got to go and work in an area that looks like you and sounds like you, which was, very, very deep for someone back in the 70s to realise the unconscious bias he would face.
Yeah.
And so opportunity had it. We could buy a practice either in Ponsonby or in Otara. And I was brought up in Otara. Those were the days of the machete murders and the dawn raids.
Yeah.
And I says, we're going to Otara. And he says, well, that's where the business is.
Yeah.
So we had to borrow to buy the business, 100%. And, when I said to you, we're very fortunate, no one would give us a loan. So my uncle in Pukekohe called his back manager from Westpac for dinner on a Sunday night and said, I think you should back this couple.
Yeah.
And the loan was given on a Sunday night by Westpac. And so we were loyal to Westpac for the past 50 years.
Wow.
Because,
nice.
When you don't have anything and someone helps you.
Yeah, well, it sounds like there were just really quite, barriers to entry for immigrants, and clearly in New Zealand at that time it wasn't easy. There was things that hopefully have changed to some extent.
No.
Yeah.
For in the professional arena, we've got so many professionals from India and other countries that their degrees aren't recognised.
Yeah.
They can't work to their capacity. And frustration sets in very quickly.
Yeah, it feels like New Zealand's missing out because we've got these shortages and you've got talented people.
Yeah, very much so.
Yeah, no, that is a shame. We could maybe talk a bit more about that when we get to the fact that you've got a bunch of clinics now. We were talking earlier about entrepreneurialism, but do you feel you and your husband are entrepreneurial people? I mean, at some point, some people would be happy with a clinic and you could have a good life off it, but you guys decided to take some chances and expand.
And I think, as my husband reflected quite often, I was 26, had no business experience, and bought a clinic. And so it was more a survival.
Yeah.
The model of medicine back in the 70s was you got an appointment and you went to the doctor. In Otara, that wasn't going to work. If it's raining, the people wouldn't turn up because I've got 3-4 children. And so we had to change within the first month because we could see it wasn't going to pay the mortgage. And he says, okay, we're opening from 8 to 6 p.m. You cover the lunchtime and you book people in. I'll go and have lunch and we're going to open Saturday morning. And hence, that's what the population needed.
Yeah.
And so we became very busy. So the local doctors complained about us, that they must be doing something dodgy, they're Indian. Yeah. And so we got audited. And then the restriction came, you can't see more than X number of patients. And my husband says, there's an Indian saying that when a candle comes to your door, a gift comes to your door, you don't turn it away. And patients are coming through the door. And we're not going to turn them away. So we hired locums. And so we got busier. We grew out of our place. We moved 3 times. And then in 84, we invested in computers, which was the price of a house back then, 40,000.
Wow,
and air conditioning for the dot matrix printer because it would get jammed. And so we took on locums as doctors. And, today 50 clinics, over 300,000 patients registered under the clinic. So it's a service people want. It is now the buzzwords to have access, but to us, access was a priority, which was in timing, which was in financial reasons, and to services.
Yeah, I mean, it's an incredible growth story, and it has been told before, but going from one clinic and growing fairly organically to that scale that you are now, did you have to then leap back and do some work on business skills and things like that, or did you just learn as you went? Because I guess
just learned as you went.
Some people have had people say to me it's just extra zeros on the end, but
no, I had to go and learn Excel. When I went to secondary school, you either did sciences or commerce or arts, and I did sciences, so I had no typing ability, I had no accounting ability, but I learned very quickly. Yeah. So, doing PAYE on the books, the manual ones, using slide rulers, people probably don't even know what they are now.
Yeah.
And also, my husband says, I'll look after the patients, you do the rest, which meant the cleaning, the reception, the HR, the accounts management, the hiring, especially interviewing even doctors. I did that. And, until we sold to private equity 6 years ago,
Yep.
I sat on the last interview of every single nurse and receptionist just to say, are you here to serve? You are coming into a very high needs community.
Yep.
And if, this is just a job, you will not survive.
People understand the culture of the company. Yeah.
It is, you're here to, serve. And with that philosophy, we had the biggest problem of retention of staff because people would stay and they'd bring their husbands, their children. And to me, that was, something that we did for the business, because if you ask your child to come and work in a very high needs community, very sometimes volatile, ask your child to come and work, the environment is where you want your child to be.
Yeah, sure. I mean, were there tough times as the business grew? One of the questions I always ask is, what's the poorest you've ever been? Or I guess, what the most, close to the line you were with the business? Were there times, because you're going through some big ups and downs with the economy over that period?
I think we're very fortunate that we always had patients come through the doors.
Yeah.
Our biggest barriers were the bureaucracy. Because we did things differently, we were looked upon suspiciously. So the DHB on several occasions said, well, we're not going to pay you for that anymore. You have to do it our way, which was the colonial white middle class way of doing things, which wasn't working for our patients. Output is one thing, but outcomes is more important. And, I had no marketing budget. My husband said the marketing was, word of mouth.
Yeah.
Because you would ask someone, do you know a good doctor?
Yeah,
and then, we have 3-4 generations of people coming to us.
Do you feel like the health system has improved, or you've broken through some barriers there over the years?
Very hard to say. We are the biggest Pacific and Māori providers, but because I'm the colour I am, we were never recognised as that. Our outcomes, we probably in 15 years had closed the equity gap with our population. Because I always say, I'm third generation here. My grandfather came out in the 20s.
Yeah.
But I'm always going to look like this. And so I'm always going to be fresh off the boat. I have to treat her like an Indian. But I'm more Kiwi. My grandkids are still looking like this.
Yeah.
And yet they haven't been to India yet.
Yeah.
And so you're always judged like that you can only serve your people.
So it's kind of an extra barrier that you have to get through before you can move forward.
Yes, and if you treat people with respect, that is the outcome you will get. Respecting everyone's culture, everyone has their own nuances, and you can be a European person with your own culture.
Yeah.
It's not that you all fit into one box. We all fit in a new migrant is very different from me.
Yeah.
And what we can do and how we can do it.
Yeah. I mean, one of the things I was going to ask is, whether you think, I guess Indian culture, but Hinduism and those sort of things, do they have a different, is there a sort of a different attitude to money or anything like that you would say is sort of a cultural aspect to money in this?
Culture, you could say it's a cultural aspect, I think, but it's like the more not to religion necessarily, but the more you give back to community, the more you will be rewarded. I think it's a philosophy of give and it will come to you. And my husband always said, I look after the patients, you look after the business, because if you look after the patients and give accordingly, the business will look after itself.
Yeah.
You just need to maintain and dot all the I's and cross all the T's. So is it a Hindu philosophy, or is it just common sense philosophy?
And you might find it through the Pacifica communities and other places like
most
that, right?
Eastern cultures.
Yeah.
I think most Eastern cultures have that philosophy. Some religions will say give 10% categorically, but ours was never like that. I think it is, and we learnt with the temple that we've built in Papatoe, that we built it from a Samoan church, and it took us 5 years to build, but we outgrew it because people wanted a place to go.
Yeah.
Pastoral care was needed with all the international students when we opened. So, I think the more you give, the more you get is sort of a philosophy we've always been on.
Yeah. It's almost ironic, but I just noticed over the last few years there has been, a lot of the recognition is coming through the business community who, there's these business awards and things, and that, I guess, because, the success of the business, that you've been recognised through that. Do Do you feel part of that sort of Auckland business community through that?
I think when we were just, 30 years before how Main Street caught up with us.
Yeah.
Saying access is important, diversity is important. Those things weren't important when Wellington wrote their mandate on how to deliver health.
Yeah.
But now they realise they've got to be with what Auckland in particular looks like, that you've got to work with the diversity you have. And finally, when I won the EY Walk the Talk, and they said, how did you manage to get so multicultural? I says, nobody wanted to work in South Auckland.
Yeah,
it was only the local community. I says, I didn't do anything special, but I respected the people that came through the door.
Yeah. I mean, it almost makes this question, you've sort of answered it, but, making money, I ask, is how important is that, and how much is it a byproduct of the success, for you? Has money been a driver for, for expansion and for doing things?
No. I think if we worried about the money side, whenever we opened a new clinic, it was because we had computers since 1984 and we could do a demographics where our patients lived. And when we looked at our demographics of, in Manurewa, we have got 30,000 people that come to East Tamaki. Why don't we build a clinic there? Knowing that if we do build a clinic, it's a 5-year turnaround before we start making profit.
Yeah.
But that's worked for us. So I think it's more seeing the gaps and filling them for our patients.
Sure, yeah. Can you briefly just tell us about Gandhi Nivas and the whole foundation? What prompted you to start that, and how's that going?
We started a foundation in our health organisation. We called it a community care company, where we put an X percentage of our income to do community work, with which we started doing our after-hours clinics, our free clinics that we did in communities. And then when we sold, I changed it to Serenity Foundation. And in the year 2013 data, I sit on quite a few police advisory board, the National Ethnic Board, as well as the county's Manukau. And 4 out of 14 deaths were Indian women, which is 29%, when the population was at 3%.
Wow.
And the area commander said, your community's growing, there's a problem, you need to give us some solutions or give us how we should be dealing with it. And I says, like most of us saying, no, not my community, that community, that community.
Yeah.
We're good at pointing fingers. And he says, no, data doesn't lie. There is a problem. And so I sent myself to MIT to try to understand it. But with police being as partners, they got all the providers together. When you're not personally involved in a volatile situation like family harm, you stand back and listen to people. And I think that's my biggest strength, is that I'm not tertiary qualified, but I listen to people more experienced than me. And what they were saying is men need help. 95% of perpetrators are men. Men need help, but unless they're in the system, they cannot get any kind of help. So they have a criminal record before they can get an anger management course, which seemed ludicrous.
Yeah.
So, listening to everybody, they said men need help, but it has to be immediate. And I understood that with, CVD checks we used to do. Anyone that had a heart attack that was a smoker would get a call to say, because the pain is raw, you remember it.
Yeah.
So we would say, if you stop smoking, you've got 5% less chance of having another heart attack.
Yeah.
And I liken it flippantly at most times to childbirth. Ask a woman in delivery suite when she's having her next baby.
Yeah. Somehow the magic of another year or two later, maybe you forget. But
the pain, when the pain is raw. So I knew that, and all it required from what they were saying, there was police that are going to do a referral, counselling services that were happy to do the service, and they just needed bricks and mortar. And it seemed like an easy solution. So I says, how hard can that be? And so common sense just prevailed. And I'm an entrepreneur because I use common sense.
Yeah.
But, and then coming from a health background, and police being partners, they sort of went through everything, protocols, procedures, down to the fine detail.
So was this creating a space for men to go to learn to deal with the anger, sort of
That's
removing them from the home as
Instead
opposed to
of
the
the-
model we had with, well, we still have it, and it's still important with the women's refuge. But
Yes.
but when, let's face it, the violence and the problem is with the men,
Yes.
you attempt to get them involved first.
Yes, and what we said, 2-3 things like most NGOs work 9 to 5. Most incidents happens in the evening and weekend. So mismatch of service.
Yeah.
Had needed the accommodation and needed qualified and registered people. We're all do-gooders, but we can say the wrong thing at the wrong time.
Yeah.
And so when a man is brought in at 2 o'clock, you need to have someone that has the right conversation then and there. So those were 3-4 of our, and it had to be free.
Yeah.
2-3 things that we said would make it a success. And so first year, and I put Massey in from day one. First year, 93% of the 100 men engaged did not reoffend again. But with my hand on my heart, 1 year is not change behaviour. And so we did 5-year research where we looked at the men's history 5 years before and 5 years after, and 69% did not reoffend again.
Wow.
Because when they'd recognise, and to me the biggest successes, over 200 men have self-referred themselves back to the home.
They recognise when the issue
trigger
is starting
point.
to arise. Yeah.
To say, can I come and have a cup of coffee with you? Can I come and do the gardening with you?
Yeah.
Asking for help without losing mana.
Yeah.
And the counsellors know if someone comes in like that, you go and do the gardens with them.
Yeah.
And have those conversations. So to me, that is true success when you see, over 200 men have done that.
Yeah.
And 69% non-recidivism for 5 years is true change.
Yeah.
Internationally unheard of.
Do you think? I mean, just because this is a show about money, but how much do you think that finances and financial stress, poverty, those sort of things contribute to that kind of family breakdown and that sort of anger in men and that frustration? Is it an issue, do you think?
It is, over 50% are unemployed that come to the home. So it is the financial part that does trigger a lot. But it's a lot of social things as well.
Yeah.
New baby in the house, you doing night shifts. It can be a lot of things that trigger it. Over COVID, went up to 70%.
Yeah, the
after
stress
COVID.
was just that much more.
Yeah, more were unemployed people.
Yeah.
So losing jobs, how to make ends meet, burden of it, putting food on the table sort of was the biggest issue that we had. So we started a lot of food parcels as well from the home. The man could be, because it's all right him being there, no income coming and no income in the home. So, he would be worried about, well, what are the kids going to eat?
Yeah,
So food parcels was a big part of it.
And it can, affect self-esteem and all those things, doesn't it?
It is.
Yeah. You mentioned, a few years ago, you guys sold to private equity. Was it a full sale? Can you tell me about the structure of that?
It was 50-50.
50. So you're still involved?
No, we're not now.
No, not now.
I resigned from the board in April.
Yeah.
And we're minority share now. But it was different philosophy from how we grew our clinic. We didn't chase any debts. We made our service welcoming. And so it's very, very different. And we didn't look at individual clinics being profit makers.
Yeah.
We looked at a collective that if someone didn't have transport, they could go to any
So the people
clinic.
buying in had to understand that. And
They
it
had
would
to
fit.
understand.
I was just going to ask, because I often ask what the most indulgent purchases that you think you've made is. Did you reward yourself after that success? Was there something you splashed out on, or you feel you've splashed out on, or I guess some areas where you enjoy spending money in your life?
I've never, but my husband decided. I've always said I wanted a sports car, Mercedes convertible, and so he bought one for me, which sits in the garage.
Oh, well,
so
that's nice.
He says, when you grow up.
Yeah.
Yeah. I've never been in a position where something I want I haven't been able to buy.
Yeah.
But I think when you work on a philosophy, you know what's in your purse.
Yep.
You didn't use a credit card very much, and you didn't spend more than what you had in your purse.
So the idea that having money now, and there's obviously the financial security, has it really changed your outlook on life since you think back?
No, I think now I'm in a position where I can give more where I see the need. I was the basic philosophy when we started the business. it was 66% tax back then, that we had 11 sessions to do. The first session was for your expenses. The second session, 2 sessions, got 7 sessions were just for tax.
Wow.
So you had, 4 sessions left.
Yeah.
And so 2 sessions were profit and the other 2 covered the business.
Yeah.
And that's a philosophy we sort of worked on.
Yeah. That's fantastic. Ranjna, thank you very much for talking.
Thank you.
This has been Money Talks. Thanks for listening. If you've got feedback, drop me a line at liam.dan@nzme.co.nz. Thanks to my producer, Ethan Sills, and my editor, Leanne McDonald. You can follow Money Talks on iHeartRadio or wherever you get your podcasts, and we'll catch you again next week.